Hello and welcome to our third installment of the Regional Report Outs. This is the Southeast region. Every Tuesday at 4:30, we'll be here to get an update on what's going on with the healthcare system in this region of Kansas. And we're grateful for our guests here today. My name is John Rolfe. I'll be your host for the meeting. And just a few housekeeping items to get us started here. So if you would like, and I recommend signing up here at covid.ks.gov/report-outs. You can sign up with your email address, and this call, along with the dashboard, will go out to you immediately following. And so you can digest it on your own time frame if you can't make it live. That's covid.ks.gov/report-outs. And there's also a map of the regions if you're curious to see that. And there are links to these individual dashboards and sites. So if you have comments or questions for us you'd like for us to discuss on the next call, you can email us at ksregionalreport@gmail.com. That's ksregionalreport@gmail.com. And last but not least, if you're looking for a testing site, a free testing site, you can go to the website gogettested.com/Kansas, gogettested.com/Kansas, and find a testing site near you. So far, that's been good. We're getting about 10,000 more tests in a day from what I hear from the Secretary of Health. Okay, as we go here, so what we like to do is I'll start with going through the dashboard that our friends at the Kansas Hospital Association have put together for us for this region. And then we'll get color from Destiny and Public Health and Bruce in the hospital system of what's going on. And Dr. Watson's here to help us know what's going on with transfers. So thank you all for your time. Let me kick it here to the dashboard. Okay, so you'll see here at the top, it's December 28th. That's Monday. The Hospital Association puts this together on Monday. These are static numbers we're looking at. And I'll just remind everybody, they do live in a very dynamic and fluid environment in the hospitals. And so they do change through the day, but this is where we pick every Monday. So you can see that point in time, week to week, how it changes. There are 11 hospitals reporting in the Southeast region. That's how many hospitals are. Fortunately, only 3, about a third of those were anticipating staffing shortages, which is something we like to look at because when hospitals come into a pinch, it's stuff, or space. Staff has been the main issue of late. That is one of the lower numbers we've seen of the 7 regions. And as you come across here, you can see the COVID patients in beds and in ICU beds. And then we like to look at the total staffed ICU bed availability. It's adult staffed ICU beds. An unstaffed ICU bed is just another bed. That's why we like to look at this. So 32 adult staffed ICU beds in the region this week. 8 available at this time yesterday on Monday. So 25% availability here, which is slightly better than the state average. I've been promising on other calls, I'm going to look into the COVID death rate. If you look down here with the 3, I think it's just the previous day's deaths. And so we're going to look into that number and I'll give you more. But here's some good news. So some concern here the last few weeks here in the Southeast region where a lot of the state had peaked here in November, but into December, the Southeast part of the state continued to rise. This is the first time we've seen a down marker in that. Now, we don't know how much of that's related to just less people testing because of the holidays in a shortened week. I'll flip over here to another page. This is new. KDHE is putting this together by the Healthcare Coalition Regions, which is our map. If you go under hospital capacity on their stats, you can see this. And so the Southeast region is the second one from the bottom here. And you can see the legend. This is a percent positivity. So number of people taking tests that are testing positive, generally like that to be below 5. So Southeast Kansas here, as you can see in the weeks leading up, you can see that second number is the total number of tests. So 3,200 tests, 13.5%. Down there's that bottom number that are testing positive. So I'm going to come through here just to show you how many people were taking tests. 4,700, 5,000 is more testing was coming on, 4,000. 4,700, 5,800, 5,600. Then this last week down to 4,000. So you can see that's where that drop is, where the past 2 weeks had been, up there above 5,600 down to 4,000 and a 14.25. So getting close to that 15%. Only a few tests taken this week so far, 70, but higher percent positivity rate. So that'd be something that we'll be watching as the week goes on here. And then here on the second page is a map of the region, the counties, and the percent of the population have tested positive in those counties. And then we like to look at the census of the ICU beds. A lot of times this time of year, the hospitals are near capacity just with non-COVID patients in the ICU, just because of the seasonal aspect of healthcare. But you can see that there are 17 COVID patients taking ICU beds right now, which is over half the beds available in the region. All right, that is our dashboard for this week. Now let me kick it over to our friends. We'll go to Destiny Wheeler in Wilson County. If you'll introduce yourself to everybody and give us any color you'd like to from public health.
Yeah, I'm Destiny Wheeler. I'm with the Wilson County Health Department here in the southeast corner of the state. Well, not the very southeast corner, but down in that region. I do want to, when you were just looking at the percent positivity dashboard that KDHE provides us with, one thing that I do want to point out is that those percent positivities and those tests are only PCR tests. In some of the hospitals, I know specifically in my county, the majority of what we're doing are antigen tests. So those aren't counted at all in the number of tests being done on that graph. So we are actually testing a lot more people than that, I believe. I don't know that it would affect the percent positivity a lot, but there are a lot of tests being done in the state still. And I do wonder too about our little dip there. I hope that it's a trend on our new cases in the last week. I hope that it's a trend and not just kind of a fluke like that other little teensy dip at the end of November. So fingers crossed that continues. But I just wanted to point that out about the number of tests. I always reach out to my partners, my regional partners, before these report outs, because I want to kind of, if I'm going to speak for a group, I want to hear what they have to say, and I'm hearing a lot of frustration from my partners this week on a number of different things. We most of our long-term care homes have been contracted with the large pharmacies, Walgreens and CVS, across the state. And I know that our long-term care facilities, at least the ones that I've heard from, they're not getting a lot of good answers of when they might actually get vaccines. So that is frustrating to them. And we really, really want to get them vaccinated. So that's one slight thing that we've kind of been dealing with and trying to help with. And then the other is the vaccine rollout. We are all so excited to have vaccine. We are just getting some mixed messages on when and exactly how to use it. So some people are telling us once you get through your 1A tier, go on to the next tier and just get as many people as you can. And other people are telling us, no, don't go on until CDC says it's okay. And we're just getting a lot of mixed messages there. So trying to navigate through those messages and be sure we're all doing basically the same thing is not only, within our region, but, throughout the state is a little bit of a, it's not terrible, but we all want to be on the same page. We don't want to be giving our 1B people the vaccine and then have another county come over and say, well, they're doing it, why can't we do it? Consistency is so important, and we really, really want to make sure that happens. So that's one I guess hurdle we're facing right now as public health is trying to decipher the messages and figure out which ones are the best, I guess, most consistent. Really, that's all we've kind of been doing this week, it's in the last week, is vaccine stuff. Of course, the same contact tracing and things that we had been doing. But again, I think our numbers, I'm going to knock on wood here, even though I'm on video, our numbers in our county, especially, are lower than they've been since the beginning of the month. So I'm really hopeful that we can have a break to catch our breath, get a clear path of where we're going, and yeah, move on from there.
Thank you very much, Destiny. Appreciate it. That's a good report out. And I was on a call with a lot of the rural hospitals and the Secretary of Health, Dr. Norman, earlier today, and there were others expressing that same frustration. So I know it's gotten to the top there. But there's, I guess, direct ships from the feds and then the pharmacies and all that. So there's a lot of different points of information. And I'm sure everybody understands, but I know you guys get caught in the middle between the public wanting answers and you trying to get answers. So again, appreciate all the hard work that you and your cohorts in the region are doing. Let me pass it over to Bruce. Bruce, if you'll introduce yourself and give an update from the hospital side of things.
Sure. Bruce Witt, the Chief Advocacy Officer for Ascension Via Christi. For our hospital in Pittsburgh, kind of along the lines of what Destiny referred to, our numbers are down as well. We had been averaging in the kind of low to mid 20s of COVID patients in our hospital in Pittsburgh, and today we are down to 17 with only 3 in the ICU. So from a staffing standpoint, that's a much more manageable number than what we've been experiencing. So that's been positive. We actually have more staff returning to work that were in quarantine than those that are going into quarantine right now. So again, from a staffing perspective, we're in a much better place. On the vaccine front, we've administered 405 doses of the Pfizer vaccine to our associates in Pittsburgh, our frontline workers, and have about 110 of those left. And then we just received 110 doses of the Moderna vaccine. So that process continues to move along well, at least for our frontline workers at the hospital. I think one thing, kind of again back to Destiny's comment about that we're hoping this trend continues. We've kind of seen the same thing in Wichita. Our hospitalizations are down, but we also had a pretty busy weekend in the emergency room. I don't know if that was the case in Pittsburgh, but I know in Wichita that was the case. So again, kind of holding our breath a little bit, kind of waiting to see, what the Christmas holiday and then moving into the New Year holiday, kind of what impact that will have on just the number of cases. Then one last thing, I know Drew Talbot mentioned the positivity rate in Crawford County sounds like it's a little higher than some of the other as far as the regional number, but that's not translated into more hospitalization. So that's kind of another positive thing that we've noticed.
Thank you, Bruce, appreciate it. And now we have Dr. Watson here with us. If he's got some regional data as it relates to transfers. So Dr. Watson will let you present that information.
And if you can make me host, John, I'm sorry.
Oh, sorry about that. I forgot to do that. And while I make him host, Dr. Watson was a practicing physician in a Pittsburgh State guerrilla, most important on this particular call, and helped co-found Cheyenne Mountain Software, which is the producers of the Mission Control app, which is helping with the transfers and is rolling out across the state and giving us good data on what that's like when things get more severe and you need to transfer into a larger hospital with more tools in the toolkit and specialties, or when they're transferring back out into the rural for recovery. We're seeing it both ways. But Dr. Watson, why don't you go ahead?
Yeah, it's been interesting looking at the different regions over the last couple of weeks, because there are some different experiences, and I think Southeast is has definitely its own profile. We're still seeing upwards into 40% of the people that we're involved with being COVID suspected or COVID positive. We are dealing with a population that primarily accesses Mission Control to help find a bed. Almost 86% of the people that are accessing Mission Control are looking for beds. I will say, again, half of those are not COVID patients. And so that's been interesting as well. I do think the one thing that we're seeing as far as capacity in the Southwest region, from the time the request comes in to the time EMS arrives, it's about an hour and a half typically. If we look at people who are looking for a bed for this population, it's down about an hour. And I think this is different than the rest of the state, that we're having a lot better time finding beds, finding placement for patients in the Southeast region than we are in other regions. And I think this speaks to some capacity things, being able to access the corner of Oklahoma, certainly Missouri, the Joplin region, and then still having access to Wichita and Kansas City. There's just a different level of availability for beds, and certainly even regional differences in the disease get negated because you're working with several different populations. So speaks well to what's happening out there with the rest of the state. And I do think we're seeing, if you look at the top, the acuity index is dropping, as well as then the percent positivity of the COVID. So I think overall, these are encouraging things across the board. And I do think it's a little bit deceiving, as has been stated, the positive cases that we see. If you just looked at that number, you would tend to think that Southeast was being hammered worse than anyone else. But I think the key was what was said, that they just aren't translating over into hospitalizations. And even if they are, the acuity is such that it's not clogging up the system. So less severe patients that are moving through quicker, and we're able to find placement faster.
Thank you, Dr. Watson. Destiny or Bruce, anything you'd want to add to that after seeing information, or questions for Dr. Watson?
Not for me.
All right, that's a good call so far. You guys are good. Hey, I'm going to give a couple housekeeping items out there for everybody listening. So, during troubling times, there are people who try and take advantage of others, and there are some vaccine scams going on out there. KDHE sent me 3 bullet points of ways that they've seen people scamming others around us. So I'm going to read them to you. You might make mental note or think about sharing with someone. It will be attached to the email that gets sent out following this call, if you can want to look for it there. So 1, you will not be asked for money to enhance your ranking for vaccine eligibility. So no one should be taking money from you to move you up in line, okay? Second is government and state officials will not call to obtain personal information in order to receive the vaccine. So anybody calling you saying they're an official asking for personal information over the phone, do not give it to them. And number 3, you will not be solicited door to door to receive the vaccine. So anybody knocking on your door, talking about the vaccine, you tell them take a hike. So there's 3 ways. Don't give anybody money. Don't give anybody personal information over the phone. And no one should be coming door to door to talk to you about giving you the vaccine. So please help spread the word on that. Also, Kansas Chamber of Commerce, our friends there have let us know that there's a lot of unemployment fraud also going on in relation to the pandemic and everything going on there. It's happened to me twice so far. And I know it's happening everywhere out there. So there's a way to deal with that with the Department of Labor. And I just want everybody to be aware, whether you're an employer or an employee, you got to deal with it. So unfortunately, there's bad actors out there taking advantage of things in bad times. But we like to end with bright spots. That's people taking advantage of these times to bring light into the world instead of darkness, more darkness. So here's a bright spot from Southeast Kansas. I like this one a lot. And you guys, by the way, out of Southeast Kansas, were my bright spot that I shared with the State Finance Council last week. That Humboldt Police Department was so good. Southeast Kansas, here you go. A group of developmentally disabled Kansans and independents is creating T-shirts with statements about public health practices to slow the spread of the virus. They'll distribute the T-shirts to members of their community. Now, this comes from Kansas Leadership Centers doing a Stop the Spread 1,000 meetings with groups around the state to talk about what they can do to help stop the spread. And so here's a group of developmentally disabled Kansans leaning in and doing what they can by writing the messages on shirts and handing them out. I'll tell you, it's an effective method. Throwing it on a t-shirt, it's worked for a long time. So proud of that group for stepping into this, and just reminds us all that there's something that we can do to help. And sometimes that's just bring a little kindness and a little generosity and a little of ourselves into the mix here. So I want to thank everybody for being on this call. Is there anything any of you'd like to add before we sign off? I appreciate you giving up time during a holiday week. And we'll be back next year at the same time. It's every Tuesday at 4:30 for the Southeast region of Kansas. And we wish you a Happy New Year. Thank you guys very much.